Ladies and gentlemen, this is Mike Roth. Prepare for an unforgettable cinematic experience. Mark your calendars for Friday, March 7th at 3 p.m. for the world premiere of the highly acclaimed and anticipated blockbuster, Bad Senator, a dramatic comedy about a retired senator who has lost everything until a spirited woman moves in next door and turns everyone's lives upside down. This movie, inspired by real-life events of us, the residents of the villages, and filmed in and around the villages in late 2022, will captivate your heart and stir your emotions to the core. Be the first to experience the magic of the big screen. Step onto the red carpet and take the glitz and glamour and immerse yourself in an afternoon of movie magic. Make sure to tell your friends. Don't miss out on this special Hollywood VIP event. Join us at the Village's Old Mill Playhouse for the exclusive limited premiere of Bad Senator, March 7th through 9th, with showtimes at 3 p.m. each day. And in true Hollywood style, writer-director Chad Richardson will join me for a special interview directly after the Friday showing. But don't worry, folks. He's assured me he'll be around after each showing and has promised to bring the now infamous Van Sutton helmet and other special props from the movie for photo opportunities. Get your tickets now at badsenatormovie.com and be part of this rare and exciting opportunity.
Welcome to the Open Forum in the Villages, Florida. In this show, we talk to leaders of clubs and interesting folks who live here in the Villages to get perspectives of what is happening here in the Villages, Florida. We are a listener-supported podcast. There will be shout-outs for supporters in episodes.
This is Mike Roth. And listeners, I'm thrilled to share with you this podcast, which is my passion project for you. This podcast brings you knowledge, inspiration, and a lot of things that people need to know about the villages and the people living here. Be sure to hit the follow button to get the newest episode each week. Creating this podcast is a labor of love, even though it demands more time I can easily spare. Now, here's where you come in. You can help us keep the podcast alive and thriving. How? By becoming a supporter. The easy way for you to support us is to visit our podcast webpage, openforuminthevillagesflorida.com, and click on the supporter button at the top of the page, or the purple supporter box. Even a small donation of $3 to $10 a month makes a big difference, and you can cancel your subscription at any time. Your support means the world to us. Stay curious, stay inspired, and keep those headphones on. I hope everyone enjoys today's show. This is Mike Roth on Open Forum in the Villages, Florida. I'm here with Jim Bodenner. Thanks for joining me, Jim.
Thanks, Mike. Great to be here.
Good. This is the third podcast you recorded with me, Jim.
It is. I almost feel like a veteran.
You are. There aren't very many people who have done 3 or more. Probably only 2 people. And today, we're going to talk a little bit about Medicare Advantage Plans versus traditional Medicare. Some things that have been happening of great interest to people who have those Advantage Plans because there's a new opportunity for them. And we're going to be talking a little bit about eating healthy. Is that fair?
That's fair.
Good. Let's first talk about traditional Medicare versus Advantage Plans. Okay, and the Advantage Plans have been offered to the American public with all kinds of incentives, from reduced premiums to 0 premiums to paying for dental work and all that. What is your opinion?
Thanks, Mike, and I'm honored to be here. Mike, I serve as the volunteer president of the Villages chapter of the National Retiree Legislative Network, which is a nonprofit, nonpartisan organization that advocates for issues that impact retirees. One of the things that I am most adamant about is Medicare and trying to educate people on Medicare options. There are really 2 ways, once you turn 65, to acquire Medicare. Everyone gets Medicare Part A and Part B, which if that's all you had, there'd be significant gaps in coverage. So people fill those gaps in one of two ways, either through acquiring an Advantage plan or an original Medicare and a Medicare supplement. As you know from our prior discussions, I'm a huge critic of Advantage plans. And the reason that I don't like Advantage plans is, number one, they are for-profit corporations, for the most part, for-profit corporations that are retained by Medicare to provide your health care. And you have to deal with a finite network of doctors. You've got to stay within that network if you want to maximize your care. The minute you go outside that network, you can have issues. One of the three questions that I tell folks to always ask is, regardless of the plan you get, what's the monthly premium? What are the maximum copays and deductibles that you could incur in any one year? And the third, and the most important issue in my mind, what are the rules on the use of hospitals and doctors? That can be a serious problem. I'm going to share with you here in a minute how this became real for me back in August of 2023. But limiting yourself to a network of doctor when you need quick, specialized care can be a problem. I feel these questions every day as I counsel people on what path to go down.
Can it be a fatal problem?
Can it be a fatal problem? It certainly can be a fatal problem, and I can relate stories. I'll talk about my own personal situation here in a minute, but I had a situation, people call me all the time, people I don't know, they call me. I had a situation recently where someone called me, they were being treated for stage 4 cancer at one of our premier cancer treatment centers here in Florida, and they were informed that effective the first of the year, that their Advantage plan would no longer provide coverage. That person's really panicked. First of all, they've got cancer they're dealing with. Secondly, they have to sort their way through what Medicare insurance to get. So yes, it can be a serious problem.
Why don't we share with our listeners what happened to between 1 and 2 million Advantage plan participants in the last couple of weeks?
Yeah, it's a serious issue. I published as volunteer president of the Villages chapter of the National Retiree Legislative Network. I have folks that help me with press releases, and I published a press release here a few weeks ago. And the numbers that I used was that about 1.1 million people on Advantage plans nationwide were being terminated from those plans effective right now this week.
Dropped.
They were in zip codes that the insurance companies didn't like, and they terminated the coverage for those Medicare recipients.
Were any of those zip codes here in Florida?
Not that we're aware of. Certainly the companies were, there were some big time companies that terminated those folks. The numbers I used in our press release was 1.1. The New York Times did a follow-up story, and they had the number all the way up to 2 million. We don't really know. You don't know because you're not getting copies of those letters. But the point is, what happens if you get a letter and you've been terminated from your Advantage plan? There's good news. If you get proper notification, there can be really good news buried in that letter. Because if you are terminated from a plan, you have guaranteed rights to get additional coverage. You've got what's called special enrollment rights, and you've got the opportunity to go back and to acquire either an Advantage plan or a Medicare supplement. So it would be good news. If you got terminated and you were on an Advantage plan, you didn't have the right to switch to original Medicare and a supplement because of the rules, you might just now have special enrollment rights at a guaranteed issuance rate to acquire a Medicare. And in my opinion, the Medicare G supplement is the best supplement available.
So that's like a rollback to age 65. Without any medical qualifications, you could pick the Medicare supplement G, which is the best one.
Yes.
With no penalty.
Correct. And if people know that, the concern is, are people being informed that they have those rights? And we don't really know because we're not getting a copy of those million plus letters. But people do have those guaranteed issuance rights if they exercise them. But they need to move quickly. They need to make that election very quickly.
Let's hope some people hear this and take advantage of that change. In your own health situation, I understand you had a minor heart problem on an Indian reservation. Tell our listeners a little bit about what happened.
I'm a critic of Advantage plans. It got real for me back in August of 2023. My wife and I were traveling around the country. We were boondocking off-grid on the Cherokee Indian Reservation in North Carolina. In the middle of nowhere, no people, just the two of us enjoying nature, enjoying life. My iWatch, which I had just recently acquired, woke me up at midnight on August 8th, 2023, and told me to seek immediate medical care. You've got to be kidding me. You've got to be kidding me. Once I woke up, I realized I had a problem. My heart was racing very fast. I didn't know what AFib was at the time. I learned very quickly what it was. My wife got me to the emergency room at the Cherokee Indian Reservation. No questions asked. I got immediate medical care. The emergency room doctor got a hold of my cardiologist down here in the Villages. They talked through what they should or shouldn't do to me. I got professional, prompt care. They removed my heart from AFib with the proper treatment. When I got home, I saw my cardiologist. I went through a complete cardiac workup. I ended up with 2 cardiac stents and a cardiac ablation. Questions asked. I was dealing with some very talented specialists. I got care I needed. I didn't have 1 penny of out-of-pocket costs.
When did you go for the care?
In August of 2023, this process started. It took some time to do the whole cardiac workup, but last year, late in 2023, I ended up with 2 cardiac stents and a cardiac ablation.
Was that here in the Villages area?
It was a professional group of cardiologists and, of course, an electrocardiologist and a cardiologist that provided my care. No referral was required. I got the care I needed. I elected who I wanted to go to, and I got the care. No questions asked. I didn't have to get a referral to see a doctor in North Carolina.
And what was your total out of pocket?
The total out of pocket's a real easy number to remember. The total out of pocket was $0 out of pocket. How much were those 2 procedures and the emergency treatment? I don't know. It ran into the thousands, tens of thousands of dollars, I'm sure. The key thing though, is that I didn't need a referral. I didn't need an Advantage Plan administrator telling me that, well, maybe I don't need that cardiac ablation.
Or don't need the stents.
Don't need the stents. When it was comical because the ablation, the cardiologist called me and said, we want to do an ablation. We have to get it pre-approved because sometimes insurance companies won't approve the cardiac ablation. I started to laugh and I said, no, you don't need an approval. It will be approved because your doctor has recommended it. It will be approved. It will pay 100%. Of course, I very quickly got a call back and an apology from the billing people that said, yep, you don't need an approval. We've scheduled the appointment. It'll happen on such and such a date. Time is of the essence. When you need critical care, particularly cardiac care, any kind of care, if it's critical, you need it, and you need it right now. And you don't need an Advantage Plan. We've all heard the delay and deny and delay care. We've all heard that mantra recently.
I have a friend who's got military insurance as a veteran, and they've delayed his back surgery for months and months now, and he has no idea when the bureaucracy is going to end, the treatment can begin.
It's critical care. When you're sick, when you're ill, when you need emergency care, you need it right now. Fortunately, we have some of the best care available in the United States here in Florida, from the places like Shands and Mayo Clinic and Moffitt. We have some of the best. The question is, can you get there? Can you get there with the Advantage Plan that you have?
With the insurance that you're currently carrying. Now, after your care, you decided to go on a heart-healthy diet.
This is where the story gets interesting. And I'm one of my mantras is you have to manage your own health care because nobody else will. I wrote my cardiologist and my letter after I had gotten through the procedures. I was feeling good. I'd recovered from everything. I wrote him a letter. The first paragraph of the letter was a heartfelt thank you for keeping me from having a stroke, keeping me from having a heart attack. It was a heartfelt, sincere thank you for their professional care. And it was professional.
Good.
But paragraph 2 of the letter started with the word, but that's not enough, because I want advice and counsel on health, nutrition, fitness, and lifestyle, because I'm not going to die from a heart attack. And my cardiologist looked at me and he said, Jim, I fixed you. He said, look at you. You're in better physical shape than virtually all of my patients. Look at you. Just keep doing what you're doing. To which I said, Doc, that's not the right answer. And again, I great professional care from both the cardiologist and electrocardiologist.
So where did you go next?
The interesting response from my electrocardiologist was, and again, a woman I have the deepest respect for, her response was, Jim, I just don't have the time to be able to counsel people on wellness. And I threw up my arms and I was frustrated. I was concerned. I was scared. I wasn't going to die from a heart attack. My next step is like one of those, I'm a fairly knowledgeable guy. I'm golfing in a golf group with some friends, Susan and Wallace, and explaining to her what happened to me. She did everything but hit me over the head with a golf club and said, "You're coming with me on Thursday to the Village's whole food plant-based. I want to introduce you to a program of nutrition." I did. I got engaged in that program. I started to learn. I started to read. I started to educate myself on what nutrition and fitness was all about. One of the things that just absolutely astounded me, YouTube becomes your friend when you're trying to educate yourself on technical things.
Sure it does.
It's amazing what's out there. And I came across a guy named Dean Ornish. Dean Ornish is one of the...
Could you spell that name for our listeners?
Dean Ornish, O-R-N-I-S-H. He's been around a long time. He spent 14 years getting a cardiac lifestyle and fitness program approved by Medicare. 14 years. He got this program approved a decade ago. The program cost $11,250 to take. I contacted Ornish's website and said, "I've just had 2 cardiac stents. I have a Medicare Supplement G plan, and I would like to enroll in the program." It's 8 hours a week for 9 weeks, 72-hour program. The program, I got approved instantly for the program because I had a Medicare supplement.
Mm-hmm.
My supplement paid 100% of the cost.
Now, is that a program over the web?
It is. It's 9 weeks. It's all done by live professionals. They're all over the world where they're teaching this course.
Mm-hmm.
And my Medicare supplement paid 100% of the cost. They did tell me, of course, I started questioning their intake people on how would a Medicare Advantage plan treat this program. And they said it's a nightmare. It's a nightmare. They all require pre-approval. Some will pay, some won't. It's an absolute nightmare. But my Medicare G plan, no questions asked. I didn't need a referral. I had the proper diagnosis, was 2 cardiac stents. And it paid 100% of the cost. I was concerned. I was upset.
Did your wife go through the course too?
Did not. She went through the materials, some of the materials, and she's been most helpful. We've done this plant-based journey as a team.
Mm-hmm.
I was upset with myself, first of all, that I didn't know about this program, but I was also upset with the medical profession that I wasn't told about. I went to my doc. I wrote him a letter. There was no discussion that this program existed. None.
Mm-hmm.
None. Absolutely none.
Was he aware of it?
He was not aware of it.
How did you stumble onto it?
I found it on YouTube. I went back a few weeks later after I went through the program. I went back to the cardiologist. I told him I wanted to talk to him. He very graciously spent a half hour with me and his PA. I went in with a copy of the book that was written about the program, the Ornish book. I went in with copies of randomized controlled trials that had been done to support the program. He listened to me. He thanked me. He was very sincere, but he didn't know about it. And it just makes me scratch my head in disbelief how a system can exist where we don't talk about wellness. We don't talk about, God bless my doctors that saved my life, kept me from having a heart attack.
Medicine 1.0.
But when you've got a patient who's motivated, who's asking questions, who's writing you a letter asking for help, and you don't provide any kind of feedback to that patient. One of the other key players in this whole plant-based world, a guy named Dr. Esselstyn. He's a medical doctor. He's former head of cardiologist at that small little heart place in Cleveland. No, wait, it's Cleveland Clinic.
Cleveland Clinic, yes.
One of the world's foremost heart.
The reputation is stellar.
Is stellar. It's unbelievable. But Dr. Esselstyn, I read a quote recently from Dr. Esselstyn. He's former head of cardiology at Cleveland Clinic and internationally known expert on health and nutrition and an advocate for plant-based nutrition. But his quote was that it's unconscionable not to offer patients the plant-based approach as an option for the long-term care of cardiac disease. You think about cardiac disease, it's going to kill over 600,000 people this year. It's a leading cause of death in the United States. It's 600,000 people. Can all those lives be saved by plant-based nutrition? Certainly not. But the research that's been done by Dr. Esselstyn, Dr. Ornish, and some other leading professionals, the randomized controlled trials are pretty darn clear that nutrition and exercise make a difference. The Ornish program was interesting because it's not just a program about plant-based nutrition. A good part of it is plant-based nutrition, how to educate yourself, how to prepare the meals, but it also focuses very heavily on exercise, on relaxation, on stress management. Those are all key things to slow down or reverse cardiac disease. Plus a lot of other illnesses, but I'm focused like a laser on cardiac disease.
Now, when you talk about plant-based nutrition, I'm aware that plant-based nutrition can't provide all of the vitamins and minerals that the body requires. Are you taking additional supplements now?
I do take some supplements. I was referred to a cardiologist from Michigan, that I'm seeing a cardiologist from Michigan. It doesn't replace my local cardiologist. I have a wonderful cardiologist here in the villages, but I am seeing a cardiologist in Michigan that advises me on nutrition, cardiac disease, and there are a couple of supplements that I take every day. One of the things that I always scratch my head is education is so important. Not only to educate our doctors, as we've just said, that's really important that we start educating our medical professionals, but we have to educate people like you and me on these issues. One of my favorite...
And our listeners.
And our listeners, yes. One of my favorite questions is you meet somebody in the street and you tell them you're on a whole food plant-based diet. And of course, the first question is, well, where do you get your protein? That's the first question. I got the answer down to it. I got it down pat.
What is the answer?
I've got it down pat. First of all, it's funny because these same people really don't seem to be concerned about those 600,000 people that are dying from cardiac disease or obesity that's out of control, or the ultra-processed food revolution that we're in, or the saturated fat problems that we have. But they focus on protein. I don't think anybody's died from a protein deficiency this year. Maybe they have, but not 600,000 people. But my short answer is I get my protein the same place that cows do. I get my protein from plants. And people will do a double take when they hear that short answer. But nutrition is important. Yeah, I take some supplements to balance my diet. I track my cardiac health very carefully, and I'm working with a plant-based specialist in Michigan to help me.
Good. Let's take a short break here and listen to Dr. Craig Curtis. This is Mike Roth and Dr. Craig Curtis. We're talking about Alzheimer's disease. Let's talk about omega-3 and omega-6. How should people get that from their diet?
Primarily, you should get that through beans and nuts and legumes and fish. You can take a supplement of omega-3, omega-6s. However, don't overdo the supplementation of omega-3 specifically. There was a large study published by the American College of Cardiology a few years back that seemed to show that people that took too much omega-3 might have an increased risk of a heart arrhythmia. So my recommendation is, if you buy omega-3 supplements, take it as written.
With over 20 years of experience studying brain health, Dr. Curtis's goal is to educate the Villages community on how to live a longer, healthier life. To learn more, visit his website, craigcurtismd.com, or call 352-500-5252 to attend a free seminar.
Thank you, Dr. Curtis. Dr. Curtis talks a lot about the Mind diet, which is a modified version of the Mediterranean diet, which eliminates almost all red meat in favor of chicken and other foods. Have you ever heard of it?
Yeah, let me comment, if I can, on Alzheimer's disease. It's a topic that is very close to my heart. As I think you know, my wife and I owned a long-term care business for 25 years. And in fact, we did have a locked Alzheimer's unit. As I was going through the Dean Ornish cardiac lifestyle program, I was made aware of a randomized control trial Ornish has been working on for 5 years now, a randomized control trial they know that plant-based nutrition can reduce the plaque in the heart and in lots of other body parts that are pretty important, but particularly the heart. The hypothesis was that same thing that's going on in the heart is also going on in the brain, and that there would be a link between nutrition and Alzheimer's disease. It was a 5-year randomized control trial. It was published in a peer-reviewed journal article here about 3 months ago.
What was the results?
There was a significant correlation between plant-based nutrition and Alzheimer's disease. That in layman's terms, that the plant-based nutrition can slow or reduce Alzheimer's disease.
Did it reduce the amyloid in the brain?
It did. I'm not the technical guy. There was an interesting show. In fact, I can provide you with a link. Anderson Cooper and Sanjay Gupta did a half-hour special on CNN. They interviewed Dean Ornish and took that randomized control trial and put it in English. I know what you I have a hard time reading randomized control trials.
Nice to know they're there. I don't like reading them.
I don't like reading them. But
I like reading the results.
I do too. But Anderson Cooper and Sanjay Gupta did a nice job of explaining to folks like you and me the link between Alzheimer's disease and plant-based nutrition. And it's interesting.
I'd love to put that into the show notes.
I will provide you a link to that. It's interesting, the fear factor. There was a survey that was done on what do you fear the most in terms of diseases. Cardiac disease, of course, is way up here. 600,000+ people die a year. Not nearly that many people die from Alzheimer's. People do die from Alzheimer's. But in the fear factor, Alzheimer's was number one. People feared it more than any of the other diseases. And I guess if you think about it,
It's understandable.
It's understandable.
Sure.
It's understandable.
Alzheimer's people have to live with for years. My friend Larry probably died from a stroke or a heart attack last week. Up to the moment he died, he seemed healthy.
Yeah. I'll provide you a link to the Anderson Cooper interview, but I can also give you the link to for any of your listeners that really like to read randomized controlled trials, I can give you a link to the study too.
Maybe you can tell our listeners what you think is wrong with the current medical system.
The current medical system is focused, it isn't a healthcare system. The system we have is an illness system. The system we have focuses on taking care of you and providing those interventions to save your life. My cardiologist was focused on cardiac ablation and 2 stents, which saved my life. Okay, there's no denying, and I'm eternally grateful for their professionalism. But they didn't focus on wellness. They didn't tell me on what I could do. You know, the answer is, Jim, I fixed you, isn't the answer. Because I don't want to put up an appointment on my calendar for 3 years or 5 years or 10 years out to have another cardiac stent or to have open heart surgery.
Many people do.
And that's the path that I was on until I made a radical change in my lifestyle. I fortunately had 2 golfing friends who hit me over the head with a golf club and got me motivated. They've mentored me. They've encouraged me. They've shown me the connections they have in the community.
You look like you've lost some weight.
I've lost 20 pounds, but not intentionally. The weight is a side effect of a plant-based diet. You will lose weight. Yes, I've lost weight. My lipid numbers are embarrassingly low. It's embarrassing to tell people what your LDL is because they don't believe it. Overall health effect has been great for me. Does it work for everyone? No, not everyone is going to go on a no oil, no dairy, no meat diet. Not everyone is going to do that. But if you're motivated, if your life depends on it, and you see a link between your life and you just might get motivated to do it. One of the expressions that I always is people talk about adding years to their life. That's true. I'd like to add years to my life. But I also want to add life to my years. I want to be healthy until my last breath. I have experience, my wife and I have experience running owning an assisted living community in a skilled nursing home. We know what long-term chronic care is.
Gradual decline.
It's a gradual decline.
And the question is, do you want to have a long plateau and then a sharp cliff where you fall off and die?
Correct.
And I think what you're talking about is exactly what Peter Otter talks about in his book, Outlive, which I do recommend to our listeners. And Jim, could you recommend and tell our listeners when the Plant-Based Food Club meets here in the Villages?
It meets on the second Thursday here of the month at Riverbend Rec Center. It's a great group. We've learned a lot. You got to hang around people that are smarter than you. I learned that a long time ago. Hang around people that are smarter than you and be willing to learn. And that's what I try to do. Educate yourself, surround yourself with smart people, join the plant-based club here in the Villages, and don't stick your head in the sand.
Eat healthy.
Eat healthy, take an action. Change, embrace it. Come on, embrace it.
Change is so difficult for some people.
Change is difficult. Embrace it and enjoy life.
Right.
That's really my attitude.
Great. Thanks for joining us today, Jim.
Thanks, Mike.
Remember, our next episode will be released next Friday at 9 a.m. Should you want to become a major supporter of the show or have questions, please contact us at mike@rothvoice.com. This is a shout out for supporters Ed Williams, Dwayne Romich, Paul Sorgen, Kathy Loving, and Dr. Craig Curtis at K2 in the Villages. We will be hearing more from Dr. Curtis with short Alzheimer's tips each week. If you know someone who should be on the show, contact us at mike@rothvoice.com. The way our show grows is with your help. Text your friends about this show if you enjoyed listening, or just tell your friends about the show. We thank everyone for listening to the show. The content of the show is copyrighted by Roth Voice 2025. All rights reserved.